Yeah. 6124. 1224.
Hey, Jonathan.
Hello.
What do you think?
It's great. Looks awesome. You do a whole game show in here if you want.
So can I talk to Penny?
Yeah, they can hear you.
Hi, Penny. Can you hear me? Badger, can you make them hear me?
They can hear you.
I can hear you, Premier. I was muted.
Okay. So I just, Penny, I just wanted to go through a couple of things about status of the cohort vaccinations. I'm wondering if by the end of next week, or you gotta back up, John. Way back. Keep going. Pardon?
We can turn that off.
Yeah, that's probably better, because the last thing I need to see is myself. Nothing's more disappointing to me than me. Will we be into the 60s cohort by the end of next week, or is that the week after?
Yes, not by the end of next week. It will be, our plan for the 60s cohort is to get into that on the week of April 18th.
April 18th.
Yeah.
Wow, that's a long way off. I thought we were closer than that.
We will be booking the 60s cohort the week of April 7th.
Okay, that was my, so April 7th for the beginning of the week of the 18th.
That's correct, yeah.
Got it. And Baljinder, how do you do? Thanks for joining us.
I'm good, thank you.
Good to see you. I
Thank
like
you.
your shirt.
Oh, thank you.
Are you going to tell me where the emergency exits are, or are we just going to go right into something else? There we go. Thank you. And Kathy DeLisser, did I say that right, Kathy?
Yes, you did.
Excellent. And you work for Ceres
Ceres.
Marine Group?
No, it's Ceres Terminals Canada.
Ceres.
Terminals Canada.
Ceres.
We are Terminals Canada. We are the cruise ship operator for Canada Place.
Okay. Back in the day when the world was an easier and simpler place, I used to sit on my deck at Canada Place and watch the Disney ship take off, and thinking to myself, I'm so grateful that I am not dressed as Mickey Mouse right now. This is a much better gig than saying farewell to the Port of Vancouver with a lot of loud music going on, but it's always fun to watch.
Yeah. They will be back.
Yes, indeed. Okay, so John, are you in charge? Who's in charge?
2 minutes. You've got a couple minutes still.
Okay. Ceres Terminal Canada. Terminals?
Yes, Ceres Terminals with an S.
Ceres Terminals Canada. And Baljinder Sandhu, WestJet. Pardon me? Can you do what?
Do you need to tell them how far to move out of the way?
So when you come off, just
Talk to
stand.
Julie.
She's telling.
Everyone, it's great to be here today. I'm, of course, at the Legislative Assembly on the traditional territory of the Lekwungen-speaking people, the Esquimalt and Songhees First Nations. And I'm joined today by Dr. Penny Ballem, who's leading the immunization plan here in British Columbia, as well as two people from the private sector who are going to give their perspectives on how they feel about their companies participating in the immunization rollout. And I'll introduce them later in the program. But I want to say at the outset that although we've seen significant success since the initial launch of our vaccination program, we're accelerating registrations, we're getting more people vaccinated, we have a new supply of AstraZeneca that has been secured, and we're committing that to making sure that our frontline workers get the support they need. And of course, Dr. Henry, Minister Dix, and the entire health team are focused on using any of the vaccination products that we do have that are not committed to our cohort system, starting, of course, with the 90-year-olds, which are now done, into the 80s, and now we're registering 70-year-olds, and by the first week in April, we'll start to register those in the 69 to 60 cohort. So with respect to the Pfizer and Moderna product that we have in increasing numbers, coming from the procurement by the federal government, we also have AstraZeneca that we are using to focus on outbreaks, and we're using it to focus on those frontline workers. And I want to just say I'm so proud of the work that everyone across the province has been doing to get out of the situation we've been in for the past 12 months. All of us are tired of this. They're just exhausted with COVID-19. But we are not out of the woods yet. We have several more miles to go before we rest. And I want to just keep reinforcing that with the people at home, that although there is extremely good news on the horizon in the weeks ahead, we still have weeks to go. And I want people to be very, very mindful of that. Although all British Columbians have risen to the challenge over the past number of months, I want to pay particular homage today to people and businesses who have been trying to do their part to make sure that we meet the objectives of having everyone who wants to have a vaccination done as quickly as possible. And when we think of the hardest hit industries, of course, right at the top of that list is our tourism sector, and our hospitality industries as well have seen a reduction in their ability to serve customers, and that has led to declining employment in some sectors. We today are announcing a program that we put in place with 14 businesses across the province, taking advantage of that superior hospitality the tourism sector is so renowned for here in British Columbia, to make sure that we can put some of those furloughed workers back to work. Some 1,400 laid off tourism and hospitality workers will now be doing non-clinical staff work within our immunization centers. And Dr. Ballem will talk about some of those details in a moment. But I just want to say that it's with the assistance of these workers, some 1,400, as well as the countless volunteers that have been stepping up to say, how can I participate in the end of COVID-19 in my community? It's really quite heartwarming. I spoke this morning to Jennifer Rice, the MLA for North Coast. She's in Prince Rupert. She's also the Parliamentary Secretary for Emergency Preparedness. So she has spent the past number of summers going to communities that are dealing with floods, dealing with wildfires. So she knows firsthand the impact that emergency and crisis can have on the fiber of a community. And of course, in Prince Rupert, we had months and months and months of no cases, no evidence of COVID-19 whatsoever. But in recent weeks, we've seen an increase in caseloads. In fact, a startling increase that led Dr. Henry and Dr. Ballem to make the decision to immunize the entire community of Prince Rupert and Port Edward. And that means somewhere in the neighborhood of 10,000 people were in line to get vaccinated. And Member Rice reported to me this morning that 85% of the people in Prince Rupert have received a vaccination to this point in time. There's euphoria in the town that has been in dread, quite frankly, over the past number of weeks. And of course, the Journal of Record in the north is not any of the major newspapers or the major television networks, it's Facebook. And on Facebook, you can see from people in Rupert and the environment talking about how proud they are of the work of the community to step up. 400 volunteers stepped up without any advertising, without any prodding, to come and help. And that's the attitude we're going to need in communities right across British Columbia as we go through the next number of weeks. So I want to talk a little bit now about the 14 companies that have stepped up to help our health authorities, and of course Dr. Ballem meet our objectives. Our co-pilots in this endeavor are Air Canada, WestJet, of course YVR, the Vancouver International Airport. Our teammates in this endeavor are the Vancouver Canucks, the Vancouver Giants, and of course the Fraser Valley Bandits. And of course community organizations like the Pacific National Exhibition, the PNE, Ceres Marine Terminals, providing employees to help us, Tourism Whistler, Destination Services Pacific, the Pavilion Corporation, as well as the Red Cross of Canada. And that's just to name a few. There are industry groups like the BC Business Council, the BC Chamber of Commerce, all offering to help deliver on what is the most extraordinary undertaking we as a community have ever taken. These are challenging times, but they're also inspiring times. And we have two people joining us today, Baljinder and Kathy. We'll talk, Baljinder from WestJet and Kathy from Sirius Terminals Canada. But before I ask them to offer their thoughts on how they feel about participating in this extraordinary community endeavor, I'll ask Dr. Ballem to give us an update on where we are with respect to the vaccine programs, and then we'll get into our friends who are helping us out on the way.
Thank you so much, Premier. It's just a pleasure to be here today and to celebrate really the ramping up of our mass vaccination program all over the province, as you said, and particularly to celebrate our partners, both in communities and in our business sector, our local governments who have all stepped forward to actually help make this a success. We have partners that are helping us get the word out, address vaccine hesitancy, help people get to our clinics. We've got different partners who are providing us with facilities to host our clinics. And today we really want to celebrate a remarkable group of companies and organizations across the government, private, and nonprofit sector who are actually bring remarkable skills to our ability to ramp up vaccination programs and run these very complex vaccination clinics. As you mentioned, these are companies that have suffered significantly in the last year of this pandemic, and many workers laid off and unable to do their normal jobs. And we are just extremely grateful to have them stepping forward and bringing their incredible skills around welcoming people, managing the flow of large numbers of people through complex venues, and just providing that environment that they do every day in their normal jobs, and placing that in our clinics to welcome our public as they come forward to get the the vaccine and to get hope again that their lives are going to return to normal. So the skills that they bring have made a big difference, and at the same time they've trained many people to work in our clinics and do a terrific job. And I think we all have heard from many members of the public, and particularly our elderly citizens and residents who are the first to go through our age-based clinics, just how delighted they have been with their experience and how emotional they are with having been received with such compassion and such care, and getting themselves vaccinated and hopefully back to hugging their grandchildren, being able to see their families again. And as you said, Premier, following the next weeks that are still going to be difficult to get British Columbia back to normal. So we see this as a Team BC approach. We're very appreciative of the contributions, and across this province, as you know, we've ramped up our vaccination. We've just really surpassed the 500,000 landmark of people vaccinated in British Columbia with their first dose. And we're very happy and just very grateful for the contributions of all members of our community, and particularly these 12 great organizations.
Thank you for that, Penny. And of course, Penny will be available for questions once we complete our presentation today. But I want to call on Baljinder Sandhu, who works with WestJet, and I want her to know that there's just a few people watching, hardly any, and we're grateful that you're excited about the challenges ahead, and we invite you to have a few comments about what this means to you as part of WestJet and how you're dealing with the extraordinary challenges over the past 12 months.
Thank you, Premier, and thank you, Dr. Ballem, for this opportunity. And we know the pandemic hit hard, not just us, but everybody, not just the airline industry, but the whole BC, the whole world. And it impacted so much on us from going from all these WestJetters getting laid off from furlough for reduced hours. Like myself, I am on reduced hours. I went from full-time to part-time, and that impacted us dramatically. And then WestJet came to us about a month ago, and we understand what WestJet had to go through. We totally understand. And then WestJet had the opportunity to help with Dr. Ballem and this project of the vaccination. And they asked who wanted to help out with setting up these clinics. And you know me, I was the first one to put up my hand. I'm like, I'll do it. And just to help us with our more hours and just to help the community. That's what WestJetters do. We love to help the community. And right now I'm working at with the YVR at the River Rock Casino. And so I've already been here for almost 2 weeks now. And to see all these people come in, grandparents, parents with big smiles, so excited to get them vaccinated and they can see their grandchildren. Like the Premier said, we want to get BC back to normal and our airline back to normal. And we will do anything to help out. Thank you.
Thank you very much, Baljinder. And again, it's that the hospitality sector is so critical to our economy and also to our communities. And as you can see, having enthusiasts for British Columbia and for the vaccination program, they're ready to help out is quite significant as we go through the next number of weeks and in fact right into the summer. So I'm going to call now on Kathy DeLisser. She works for Ceres Terminals Canada. She is part and parcel of our cruise ship industry in Metro Vancouver and inviting normally many hundreds of thousands of visitors. That has, of course, been curtailed for this season, but that doesn't mean we don't have eager, enthusiastic people wanting to help us get back on track and get our tourism industry back to where we want it to be. So I'll ask Kathy to say a few words as well.
Thank you, Premier Horgan, and I'm pleased to be here today with you and Dr. Ballem and our friends from WestJet. And Ceres Terminals Canada is just thrilled to be participating in this program. Our cruise and our tourism industry has been hit particularly hard, as we all have said. And of course, with the continued ban on cruise ships into 2022, many of our staff are facing another year of unemployment. This partnership has meant that we've been able to employ with our cruise partners over 300 personnel and counting to be able to work in these clinics. Not only is supporting the staff and getting us back to work, but it's also immunizing our communities. And that's a very instrumental step in being able to reopen the tourism and the travel industry. This also keeps our tourism and our cruise partners intact so that when we can open to cruise and travel again, our teams will be able to stand up fairly quickly and get back to doing what we really love to do, which is welcoming guests and visitors into our regions and into our venues. Ceres is really pleased to be able to be supporting 5 clinics in both the Fraser Health and the Vancouver Health region. And I can tell you, we stood up our first site in North Delta on Monday. And it is so rewarding when you see people coming in and they're so excited to get their vaccine that they're smiling and they're laughing once they get it. And we know that this is going to be a really big part of them being able to get back with friends and family and what we want them to do, which is traveling. So we really thank you for the opportunity of this partnership because it is going to get our communities immunized and that gets them back traveling. So thank you.
Thanks very much for that, Kathy, and thanks to both of you for stepping up to help us get past what has been the most extraordinary of years. And as I've said repeatedly and will continue to say, we have a distance to go yet, but we are getting very close to the end. We've seen an absolutely unacceptable rise in cases, particularly in the Lower Mainland, in Fraser Health and Vancouver Coastal Health, but also in the north and on Vancouver Island. So we have to continue to follow the directions of Dr. Henry. The public health orders are not there to be punitive. They're there to keep us safe. They're there to make sure that we can get the vaccines we need And as Kathy and Baljinder said, get back to regular life, getting back to the prospect of traveling, the prospect of seeing friends and family. I know tomorrow Dr. Henry's going to be talking about our long-term care facilities and how we're going to deal in the near term with visitation, which is something so critically important. I've heard from any group in my community of Langford, One, if you can more than any others, it's children and grandchildren desperate to see their parents and grandparents. And we know that, we understand that. And Dr. Henry and Minister Dix will have more to say on that tomorrow. But for now, I wanted to celebrate our industry partners. I wanted to celebrate the volunteers. And I particularly wanted to thank Dr. Ballem for stepping up and taking on the challenge of her lifetime, which has been filled with quite extraordinary challenges. And I just am so grateful for the work that all of us are doing. Wherever we come from, whatever part of the province we live in, we're focused on making sure that those around us are safe and well. We need to follow public health orders. As we say, we're into phase 3 of the program, the cohort program next month. It's just around the corner. Let's stay focused. Let's make sure we're doing the right thing, quite frankly, to protect our neighbors, to protect our communities, and to protect our province. And with that, I'll ask Lindsay to take any questions the media may have.
As a reminder to everybody on the phone line, please press *1 to enter the queue. You're limited to 1 question and 1 follow-up. First question today is from Richard Zisman, Global News.
Horgan and for Dr. Penny Ballem. There's word now that the Covishield vaccine from India, the AstraZeneca vaccine, may be delayed coming into Canada. There's talk as well about the European Union holding back shipments of Moderna and Pfizer. How worried should British Columbians be that our vaccination chain is going to be disrupted?
Well, thank you for the question. And I guess this is just another day at the office, quite frankly. We are in the hands of international suppliers. We've known this for some time. We've acknowledged it, and we're working through it. I've been in touch. My office has been in touch with the federal government today on both the India issue as well as the EU issue. We're assured by the Prime Minister's office that it's full steam ahead. We're going to continue taking our direction from those who are procuring the vaccines for all Canadians. That's the federal government. I know Dr. Ballem and Dr. Henry are in regular contact with their opposite numbers across the country to make sure that we're managing the supply as we get it. And again, I think most British Columbians would expect us to be prudent with what is a scarce resource, one that is in demand with 7 billion other consumers. When we get the supplies of vaccine, whether it's from India, whether it's from Europe, whether it's from the United States, we are dependent on people somewhere else. And that means we have to steward those resources in the interest of the broader community and use them strategically, as we did in Prince Rupert and as we will be in Fraser Health in the days ahead.
Richard, do you have a follow-up?
I do. And again, I think this one may be better for Dr. Ballem. I've heard from a few people here that are clinically vulnerable over concerns about the way the province is rolling out their vaccine registration. Laura Bradbury, for one example, says she called both her GP and her transplant clinic, and neither of them have received any directive yet about sending information to clinically vulnerable patients. So are you worried that there'll be some of these letters lost in the mail? And did the province consider GPs or clinicians being able to administer the vaccine directly to their clinically vulnerable patients because that that relationship already exists?
Mm-hmm. Yes, thanks, Richard, for the question. And I did see Laura's tweet this morning. I think I can reassure her, as you'll remember, in both January and a couple of weeks ago, patients, in these high-risk categories are basically being contacted as we speak. A letter has gone out to 200,000 of them. We know some of them have already been vaccinated because they are in the age cohorts that have already moved through. And we're very excited. This program has actually moved up along with our age cohorts, and we're actually ahead of our regular timeline that we had originally committed to. We have a very carefully prescribed process where a letter will arrive, and those individuals receiving the letter will be able to immediately book their appointment for their vaccination in one of our clinics. They will go to the call center and book it. And, you know, if they get their letter a little after we bring on our provincial digital platform on April 6th, they'll be able to go online directly themselves. We know that we may miss some. Our records in the big data sets that the Ministry of Health holds, sometimes people have changed their address. Sometimes they've come into the province recently and won't even have a provincial health number, but a personal health number. But there are mechanisms that are very clear that they can access. And we have talked with the doctors of BC. So our physicians around the province, both specialists and GPs, understand the groups that are eligible, and they will be able to help steer their patients in the direction. But I really urge everyone in those groups that we talked about and that were described yesterday in the background or in the news release, you know, you will get your letter. It's coming to you. It's in the mail, and you know, you'll get a chance to start booking your appointments, you know, on Monday next week.
Next question is from Tanya Fletcher, CBC.
Oh, hi there. Regarding today's announcement, how long will these contracts last, and how are certain staff members selected within each business? Will they have to apply, or will the companies themselves decide that process?
Well, certainly it's up to the companies, our partners here. They're working on a cost recovery basis. We're assisting in that regard. And it's as long as we need the help and the support. And I know that with our two friends today, they stand ready to go to the last needle, the last jab. We're all in this together. We're all focused on getting the outcomes we all want, which is a return to normal and making sure that we can engage with other people around the province, around the country, around the continent, and indeed around the world. British Columbia depends on our vibrant tourism sector, and it has been decimated. If we say to the world, stay home, there are going to be adverse consequences to that. So many of the tourism operators, many of those companies like the Giants and the Canucks who depend on people in seats, who are not going to have those people in seats, understand that the sooner we all work together to get our communities fully vaccinated, the sooner, not just Canada, but the rest of the world can start to interact again. So as long as we need to have these staff in place, they're prepared and willing to stay there, and we're very, very grateful for that.
Tanya, do you have a follow-up?
Yes, thanks. Retired healthcare workers were asked to sign up to work at these clinics. Can you provide an update on how that recruitment process is going, how many you've got and how many you still maybe need?
Well, I'll pass that to Penny, but before I do, I want to highlight one of my colleagues, Susie Chant, who was a community health nurse and has signed up to be retrained so that she can provide vaccinations in her community. And I think that's just a testament to how healthcare workers, even when they're transitioning from their profession into something else, still have this desire to help people, this desire to make sure they're making a contribution to the well-being of our community. And Susie's a classic example of that, and there are countless others across the province, and Dr. Ballem can fill us in on that.
Thanks, Premier. Yes, so we've been very, very gratified by the response of retired healthcare workers, nurses, physicians, other professionals who are able, under the Dr. Bonnie Henry's provincial health order, to actually help us with the vaccination. I know our health authorities are partnering with first responders who have been authorized to work with us. There are thousands of people who normally are not part of the public health cohort that regularly provide vaccinations to our children and adults throughout the year that are joining us to actually make a part of this effort. Very similar to, you know, the enthusiasm of the organizations we're celebrating today who have come to help us with the non-clinical aspects of our mass vaccination program. So we've had a terrific response. As I say, we've ramped up. We're now just in the last 2 weeks at 5 times the rate that we were vaccinating as we were back in January and February. So we're ramping up very fast, and we are very, very happy with the response that we've had from all those different groups that you heard about a few weeks ago under Dr. Bonnie Henry's order.
Next question is from Katie DeRosa, Vancouver Sun.
Hi, Premier. I'm wondering, this morning, the head of the Victoria Harbour Authority was talking about trying to reach out to Tourism Minister Melanie Mark to talk about the importance of BC advocating on the tourism industry's behalf to the federal government to, speak to U.S. lawmakers who are considering the bill that would allow cruise ships to bypass BC. And it was revealed that that meeting was turned down by the tourism industry. And so I'm just wondering if you could speak to what the province can do to work with the federal government and make sure that tourism industries who are struggling are not bypassed by the cruise ship industry.
Well, thank you very much for the question, and I'm certain that there's a miscommunication. I was just in cabinet with Minister Mark. We've talked about this issue. We've engaged with the federal government through the U.S. ambassador in Washington, Kirsten Hillman, to make it abundantly clear that this proposed piece of legislation, and again, in the U.S. Congress, I think anyone who has spent any time watching the U.S. Congress knows that the likelihood of success on any number of endeavors is remote in good times, much less in times of crisis. So we're very confident that the federal government, who made the decision to cancel the cruise ship industry activities for 2021, will be advocating, and we've made that clear to the Prime Minister's office. He understands that fully. We, of course, are disappointed that Senator Murkowski is making this initiative to try and get legislation passed, but we've looked at it. It's declared to be on a temporary basis, should it even make it to the floor of Congress or the Senate. And so I'm fairly confident that the relationships that we've had with the United States will endure, in fact, grow stronger, as I know it has with Washington State. I'll certainly be reaching out to the Alaska Governor's Office to just reaffirm and reinforce that we have a number of issues in common. Our precious iconic salmon don't just spend time in Alaska. They don't just spend time in the Salish Sea. They go up and down the coast. Our salmon bearing rivers in the north particularly are the birthplace of the salmon industry in Alaska. We've got environmental remediation on both sides of the border when it comes to historic mining claims. These are all initiatives that bring us together, and I'm confident that this blip along the way is a result of frustration, quite frankly, by Alaska that we're not having ships stopping in Canadian ports for very good reasons, and I think overwhelmingly British Columbians support that position.
Katie, do you have a follow-up?
Yes, on another topic, there was an announcement today about $16 million in additional funding for the arts sector. But what arts groups and theater groups are really asking for is when they're going to be able to open up. Struggling theaters and cinemas who are pointing to, fairly crowded restaurants and saying, why can they operate and I can't? And they haven't gotten an answer on that. What do you expect that? What are you saying to those industries who are still wondering when they can reopen?
Well, we have been working with every sector across the economy over the past 12 months. These are extraordinary times. Everybody gets that. We will not see live concerts in the short term. We're very hopeful that we can have limited seating events as we get into the summer and the fall, but that's my hopefulness rather than any edict that's coming from the health authorities or from public health. We need to get our vaccination program completed. We need to make sure that the rest of the world is keeping pace with us. If we're going to open our borders, if we're going to reestablish our very important cruise ship industry, we're going to have our headlining attractions that bring people from around the world to British Columbia, we need to make sure that not just BC and Canada and the United States are focused on immunization, but everybody else as well. And to those people who are dependent on people in seats for live performances, I absolutely understand their challenges. I have many friends in the music industry that are struggling at the moment. That's why I've asked Bob Deeth, member for Maple Ridge Mission, who comes from the music industry, to be the parliamentary secretary to work with Minister Mark on these very issues. And we are open and collaborative as best we can, but the health orders are there not to discourage creativity, not to discourage entrepreneurship. It's there to protect people. And I think, again, most British Columbians understand that. We want to get out of this just as much as they do.
Pinder Sudgeon, CTV.
Hi there. I just want to follow up on something you said earlier, Premier, about 70-year-olds being vaccinated next week. I'm just wondering if there's any details around that. And also, when it comes to these workers, can you let me know who's going to pay for it and how much they will be paid per hour?
Well, I'll start with the last part, and then I'll pass you on to Dr. Ballem for the issues around the other points that you asked about. We are supporting the industries by backstopping some of the salaries. Many of them are offering up their employees with full pay, others are not, and we're trying to balance that out in a way that meets the needs of our immunization process and also provides cash in the pockets of workers who have been hard hit by furloughing and suspension of their regular hours over the past 12 months. So this is not unlike the COVID benefit. It's not unlike any number of other initiatives and programs that both orders of government, federal and provincial, have been bringing forward to keep people working, to keep money in people's pockets so that they can get through this pandemic. And I'll ask Dr. Ballem to answer your second question.
Yes, thanks so much, Premier, and thanks for the question. We're working our way down through the 70s at this point, and as we mentioned yesterday, we've just sent out 200,000 letters, which will go out over the course of this week and early next week to those individuals across this province who we've determined are clinically extremely vulnerable. So that combined with the 75 to 79 age group is a significant number of people that will basically align with the vaccine we'll have available over the next few weeks. So we are continuing to work our way down, as you see, in a segmented way. And then these 200,000 individuals will be added to the 70s cohort because we believe they need to be protected sooner than their age would necessarily dictate. And as I mentioned earlier, the letters will be going out. Some went out last night, and we expect that everyone will have received a letter by, at the very latest, April 15th. If they have not received a letter by then, they should try and contact the call center or go online to see if they can register for a vaccination. And for the small number of people that may not find that they're in that group, that's at that time they can phone their family physician or their specialist physician and have a conversation with them. So we're very confident that over the coming weeks, in vaccinating people in their 70s and those very vulnerable patients, that we'll have a very active program and be making a lot of people, as you heard Balwinder say, very, very happy getting their vaccine.
Binder, do you have a follow-up?
I do. And Premier, Saskatchewan is so far the only province to come up with a legislation guaranteeing that workers get 3 hours of paid time off to get their vaccine. And advocates say this is particularly important for low-income earners. And I'm just wondering if you've had discussions with other premiers and if BC plans to follow suit in any way.
Well, thank you for that. And I know that Premier Moe raised this with other premiers last week. It's very much under active consideration by our cabinet. I believe we will certainly be moving to amend the Employment Standards Act. I believe we can do this by regulation. Minister Baines is looking at that. We want to make sure that people aren't, again, those who are fortunate enough to continue to be working, don't have to give up pay to get vaccinated. We want to make sure that this is as seamless as it can possibly be. We know that during elections, for example, people are required to have a certain amount of time off so they can cast their ballot. It shouldn't be any different in an extraordinary circumstance like this. So we're grateful for Saskatchewan's leadership on this, and we'll have more to say about that in the days ahead.
Next question is from Les Lane, Times Colonist.
Well, thanks. Dr. Ballem, are you confident in the reassurances from the federal government that an export ban by the European Union isn't going to affect our vaccine supply? I don't quite get why it wouldn't.
Well, I think, as you know, the federal government has done a huge amount of work, as the Premier indicated, to procure a number of vaccines for Canada. And I know that their procurement plan was for a larger number of vaccines than the country would actually probably need. And that was fortuitous because that's a risk managed approach to, our situation as a country where we don't have any internal vaccine production capacity. As the Premier has said, the Prime Minister's office has reassured us yesterday and today that they have been in discussions with the European Union and that our supply of Pfizer Moderna will be protected and we won't be impacted by the ban. You know, I think that we've been very, very lucky, and my experience so far is that the federal government is very clear with us when they can reassure us, and when they have had episodes where they're not sure, they're quite clear about that. So I feel quite comfortable that that supply, which is vital to our mass clinic vaccination program, is, you know, assured at this point, and that we will be continuing, you know, to ramp up access to vaccination for our public.
Les, do you have a follow-up?
Is it safe to say the vaccination program in BC is rolling full steam ahead on the basis of the arrangement as understood, or are you contemplating any kind of plan B if this export ban turns into a significant blockage?
Les, as I say, we've significantly ramped up our rate of vaccination around the whole province. We have 170 clinics operating in, you know, communities everywhere. You heard the Premier today talk about Prince Rupert, where we're vaccinating a whole community in that case. The same is happening in other smaller communities. And on, you know, in our big urban areas, we have very large clinics that are moving people through. We feel confident, we feel comfortable. You've heard about the AstraZeneca program. We anticipate more AstraZeneca and Covishield over the coming weeks. The US has committed 1.5 million for Canada, and that will provide about 136,000 units, doses for our province. And we've been reassured that that vaccine is available and will be coming. So we've ramped up. You know, in these situations, you always have to be able to deal with, you know, changes, and you have to have resilience. And I think we've shown very well in this province over the last few months, where we have had, you know, intermittent slowdowns in supply that we can pivot and adjust. But essentially, we are rolling forward full steam ahead to get our public vaccinated and back to business and life as normal.
Next.
And I would just add to that, Les, that it is the nimbleness and the adaptability of the plan that Dr. Ballem and Dr. Henry and Minister Dix put together that allows us to deal with the uncertainty, quite frankly, that we're all facing. And I understand British Columbians' frustration with that uncertainty, but I also know that talking to Parliamentary Secretary Rice today, that there's literally euphoria in Prince Rupert. So I know how much relief comes with the prospect of a vaccination. And we're just putting our shoulder down and focused on making sure we can get as many people vaccinated as possible, as quickly as possible. And I know that's the objective of the federal government. It does us no purpose whatsoever to lament what could be. Rather, we need to focus on what is, and that's, I think, the strength of and the fluidity of our process. And I'm very proud of what people have accomplished under these clearly extraordinary circumstances.
Next question is from Lisa Houston, News 1130.
Hi there. I'm wondering if you can talk about what the recourse is for people who are clinically vulnerable who are not included on the list.
Well, I think Dr. Ballem just discussed that, that obviously we have a good inventory through health and through the Ministry of Health and the health authorities. If there are those who fall through the cracks, they will have clinicians and specialists that they're working with, and we encourage them to be proactive. But we're hopeful, as we should be, that we will capture everyone in the program, the 200,000 individuals that Dr. Ballem referenced. But I think the counsel she gave, which is, if you haven't heard from us, contact us, or certainly contact your healthcare professionals.
Lisa, do you have a follow-up?
I do, but there's just one little thing that you didn't answer earlier. I think it was for Tanya, who asked about the cost of the companies who are coming in to help with the vaccinations. But also, as my follow-up, with schools, do you feel like there'll be some sort of relief now that, especially in Surrey where they've been in a hot spot for so long, the teachers are being vaccinated, that it will ease off some of the pressure that the province is hearing of wanting to have other measures in schools?
Well, again, I've been comfortable from the beginning with the plans that were put in place because they were developed by educators, education support workers, trustees, superintendents, parents, and they've been adaptable to the circumstances as they present themselves. And this is, I think, the most vivid example of that ability to adapt. We now have sufficient vaccine supply that we can go directly into what has been clearly our most challenging area. I don't mean schools when I say that, but I mean the Fraser Health Authority. And of course, educators and those that work in the education system are part of the community, and they're at risk as a result of that. So I'm hopeful that we're focusing our energies and our supplies, our scarce supplies, on those areas that are most required. Will there be continued discussion about how we can get better? Absolutely, and I welcome that. But for now, I'm comfortable that we are adapting as best we can to circumstances as they present themselves. An unacceptably high increase or high level of cases in Fraser Health has led Dr. Henry and Dr. Ballem to look at our supply and make amendments to help that community, and I'm grateful for that. With respect to, I thought I was clear, with respect to how our partners, private sector partners and their employees will work through their assistance in our vaccination program and in our centers, our immunization centers. We will be assisting with compensation. That will come from the budget we have put in place to meet these challenges. But many of the companies are picking up the salaries themselves. We're trying to supplement that. As I said, not unlike any other program that we have put in place or the federal government has put in place over the past 12 months. We need to make sure we all get through this together, and to have private sector partners with people that are able to move happily and with a smile on their face, large numbers of people, as we all have to do in our tourism sector, on board is a great asset to us.
We have time for one more question, and that is Mary Burke, Island Social Trends.
Hi, hello, Premier.
Hi.
I have two questions. I have two questions that are kind of budget related. One of them is you've said this morning that BC is essentially in the hands of international suppliers when it comes to COVID vaccines. And so I'm just wondering if in the upcoming BC budget, you're going to have capital set aside or some sort of incentive program for development domestically of vaccines in BC.
Well, I wouldn't say we're going to be doing that as part of our budget process. We've been doing that for the past 12 months when it became abundantly clear that Canada, not just British Columbia, Canada no longer had capacity to meet an immunization program of the scale that we're talking about. But there are other advents and breakthroughs over the past 12 months in the life sciences sector here in British Columbia. Abcelera is one company that I think of that has brought forward groundbreaking therapeutics that can help those who have contracted COVID-19 diminish the impact of those symptoms. That was done here in British Columbia. It is an extraordinary breakthrough that is being embraced around the world. Precision Nano Systems is another BC-based life sciences company that has had a breakthrough with the delivery mechanism for these messenger RNA vaccines. So again, a pivotal part of the whole puzzle happening right here in BC. And those stories are also duplicated across the country. Now, having said that, I think all Canadians are now aware not just of our deficiency in the ability to provide vaccines for ourselves, but a whole host of other issues and products and services that Canadians, quite frankly, have started to take for granted. And so all of us are looking at supply chains when it comes to food and other durable goods and things that we used to make in Canada or used to produce in Canada that we don't anymore. And I think there's a long discussion ahead of us as a community about how we address those issues. If we look for the upside of COVID-19, one of those issues that certainly I think about almost every day is how can we be better prepared for this happening again? And that is not just in terms of providing therapeutics or providing vaccines, but providing a whole host of other goods and services that British Columbians can and should be able to produce right here, but we don't anymore for globalization reasons and a debate that could go on for many, many days, but it's a debate we need to have.
Mary, do you have a follow-up?
Yeah, thanks. And this is coming from another direction in terms of infrastructure. It's more about social infrastructure, and that's the role of journalism in BC. And you mentioned earlier this morning today about how, well, in this case, Prince Rupert, how it wasn't the newspapers or TV, but that it was Facebook that informed the community. And I think people may not realize how deep the commitment of journalism is in the media industry, but it's really the social media like Facebook, as you know, that have decimated the business model of media at all sizes and levels. So I'm just wondering if the BC budget, if you'll be looking at some sort of incentive to the media business model, whether it's grants or some sort of partnership, but looking at how the media industry is shored up against social media giants, which of course we know federally is being dealt with possibly with some sort of tax adjustment at the federal level.
Yeah, well, I don't disagree, Mary, with your premise, and I think woe to the politician who stands in front of a collection of journalists and not heap praise upon their extraordinary efforts. And I'm quite genuine when I say that. The ability for the province through my regular availabilities, and of course Dr. Henry and Minister Dix in their daily availability in the early days, full credit to the media, whether it be print, broadcast, or television, to tell the story, to tell British Columbians where we are and how we're doing. But the impact of social media, and I use the Facebook example in the North Coast because we still have a lot of work to do on connectivity, connecting communities with high-speed internet. And I recall being in Nisga'a territory with a colleague. We were traveling from Greenville to Kincolith. The cell service is non-existent there, but when we arrived in Kincolith, although it was not on our agenda to go, I felt that we're this close. I've never been to Kincolith, let's go. And when we got out of the car, there were a dozen people saying, hey, we heard you were coming, because they were tied into Facebook. So it's not just about informing people of current events, it's about informing people about what's going on in their community. And I know the core of your business is using the internet and accessing clients and customers that way. I think all media models are changing to meet the changing demand of consumers. And I don't have a lot more to say other than I applaud the work of all of you through extraordinary times of downsizing in some parts of the media to the elimination of other parts. We keep going, we keep informing each other, we keep telling the stories of British Columbians, and that is an invaluable asset to all of us. So thanks to all of those who are watching, and I'm not pandering, I say with a smile, but thanks to everybody for the work that you do every day to tell the story of British Columbia, particularly during this difficult time.
That's all the time we have. Thank you for joining us.